ahead and begin our ambulation with walkers and with the cane. So we have student nurse Sue with Christine here. We're going to go ahead and start off with the cane. The cane and the walker are two of the most common types that are used in single straight leg cane and quad cane. The single straight leg cane is the more commonly used one. It's used to support and balance the client who has decreased leg strength. Okay, and we want to remember that the 2 points of support is either 1 foot or 2 feet, and the cane are present at all times. The pliable rubber tip on the end of the cane that grips the floor can help provide traction on most surfaces. Make sure that the rubber tip is supple. If the tip looks worn out, a replacement tip is readily available at a pharmacy or medical store. So step 1, we're going to keep the cane on the stronger side of the body for maximum support when walking. The client places the cane forward 6 to 10 inches. Step 2, the weaker leg is then moved forward to the cane so that the client's body weight is kept equal between the cane and the stronger leg. Step 3, use the stronger leg to advance past the cane so that the weaker leg and the body weight are supported by the cane and the weaker leg. Step 4, continue to repeat these 3 steps when walking. Alright, the next step is how to assist your patient to walk using the walker. So the walker, we want to note that the client is required to lift the walker upward and forward. When using a walker, it's important to stay upright as you move. Always step into the walker rather than walking behind it, and be careful not to push the walker too far in front. So step 1, first hold the hand grips on the upper bars. Step 2, then take a step and move the walker forward. Step 3, take another step and repeat with moving the walker forward, as demonstrated by student nurse Christine and patient Sue.
Good, now you want to lift it and move it forward. Good. Good, now go slowly. You're doing really great.
Thank you. I think I'm just going to take a rest here.
Okay.
Alright.
Good job, Sue.
Alright, for today, we will be demonstrating the use of crutches. We will be showing 2 types of crutches, 2 methods of crutches, swing to gait and the swing through gait. But before we start, there are some important reminder tips. Remember to teach the client not to lean on the crutches to support the body weight. Teach the client with auxiliary crutches about the dangers of pressure on the axillary, which occurs when leaning on the crutches to support body weight. Explain why client needs to use the crutches that were measured for him or her. Show client how to routinely inspect crutch tips. Securely attach rubber tips to the crutches. When tips are worn, they need to be replaced. Rubber crutch tips increase surface friction and help prevent slipping. Also explain that the crutch tips needs to be remain dry. Water decreases surface friction and increases the risk of slipping. Show client how to dry the crutch tips if they become wet. The client may use paper or cloth towels. Also show client how to inspect the structure of the crutches. Cracks in wooden crutch decrease its ability to support weight. Bends in aluminum crutches can alter body alignment. Provide client with a list of medical supply companies in the community for obtaining repairs, new rubber tips, hand grips, and crutch pads. Finally, instruct the client to have spare crutches and tips readily available. Alright, we're going to move on to show you how to use the swing to gait pattern. Student nurse Christine Choi is going to demonstrate the use of the swing to gait pattern. This gait pattern is used for patients who have lower extremity muscle weakness, paresis, paralysis, or require decreased weight bearing on one lower extremity. The first step, The patient moves both crutches forward simultaneously and places the tips on the floor. Next, weight bearing is shifted onto the assistive devices. Both lower extremities are moved forward simultaneously to the same point as the assistive devices were advanced. Third, weight bearing is shifted to the lower extremities for support so the assistive devices can be advanced again. This two-part sequence is repeated. Each cycle requires that the lower extremities be swung to the same point as the assistive devices were advanced, providing the name swing to gate pattern.
You're doing really great, Nida.
Thank you, Nurse Christine.
You're welcome.
Yay!
Next, student nurse Christine Choi is going to demonstrate the use of swing to gate pattern. A swing through gate pattern requires the use of two crutches or a walker. This gait pattern is used for patients who have lower extremity muscle weakness, paresis, paralysis, or require decreased weight bearing on one lower extremity, but who have greater confidence and ability using assistive devices. The first step. The patient moves both crutches forwardly simultaneously and places the tips on the floor. Weight bearing is then shifted onto the assistive devices. Both lower extremities swing forward simultaneously beyond the point to which the assistive devices were advanced and are placed on the floor. Weight bearing is then shifted to the lower extremities for support so the assistive devices can be advanced again. This two-part sequence is repeated. Each cycle requires that the lower extremities be swung through the point to which the assistive devices were advanced, providing the name swing through gate pattern. One important point to remember. For further reference, please go to page 803 of your Porter and Perry textbook.